Lifespan Learning Institute is a nonprofit organization founded by a group of senior clinicians who sought to impact the direction of mental health training by applying classic and cutting-edge research to practical direct treatment. The idea originated in 1992 when Drs. Matthew and Marian Solomon came to believe that educating oneself, lifelong learning, helps expand the mind and the brain, thus the beginning of the Lifespan Learning Institute.
Lifespan Learning Institute actually was begun by Matthew Solomon, my husband. He retired 17 years ago from business and banking career and decided that if he has the rest of his life to spend, he wants to spend it on something really valuable. When I started the seminars, it was a group of 8 of us, all young clinicians, saying, who can we learn from? We hired local leading people to train us in the different models of therapy. Attachment, mind, brain, trauma, the treatments, from early childhood through the lifespan, how do we use it to figure out how to live a better life?
The goal is the integration of classic traditions with new research in the field. A few of the areas covered in our conferences include individual and group psychotherapy, family and couples therapy, brain research, mindfulness, sensoromotor psychotherapy, and intensive short-term dynamic psychotherapy. We traveled throughout the United States. We went to see programs. We went to see who is talking and who are the best people. This is really a labor of love designed to help people learn how to work with patients, and we're trying to make therapists into better therapists. Dr. Marian Solomon is the co-founder and director of clinical training at the Lifespan Learning Institute. She is faculty in the Department of Psychiatry at UCLA Department of Humanities, Sciences, and Social Sciences. She is also the author of Narcissism and Intimacy, Lean on Me, The Power of Positive Dependency in Intimate Relationships, and co-editor of Countertransference in Couples Therapy, Short-Term Therapy for Long-Term Change, and Healing Trauma. What I do at Lifespan is focus on helping the committee to develop cutting-edge programs. An extensive advisory board based in New York, Boston, Boulder, and Los Angeles carefully developed clinical training for psychiatrists, psychologists, psychoanalysts, social workers, family and marital therapists. The goals for the Lifespan Learning Institute and my personal goals is to somehow get people really thinking about what we are doing with our patients and what's the best way to help the kind of problems that are coming into our offices today. We are committed to our search for advancements in mental health research, bringing top-rated guest speakers, which we provide to you in the form of large conferences, small seminars, and home study programs on audio CDs and DVDs. When I think of how the conference affects my private practice, doing a conference, coming home, saying there were just a few ideas that can change the way I look at things, I realized that I could do something different. I look at a patient in a different way. So what I have always said about what Lifespan Learning Programs is designed to do is to have clinicians on Monday morning after a weekend conference do something different with their patients. And that will tell us, did it work? Did they learn something? Are they operating in a different way with patients?
I just think there's something very profound about minds meeting each other in this setting, which is, for me anyway, why I'd rather go to a conference than stay at home reading a book, because I want to really have minds meet.
Marian has managed to have us come to several conferences, and she has made us relaxed at every one.
Marian's work in lifespan learning, in promoting education, she has a genuine interest in that learning too. She has an extremely wide knowledge of psychology. It's just always a pleasure to work with her.
The conferences couldn't be better organized. It couldn't be more joyfully brought together. The interaction was a marvelous holding environment our learning and growth.
There's a full feeling of community when I come, and that's very powerful because sometimes it's lonely when you're working in the office and you're doubting what you're doing with patients that are struggling and you're wanting to help them, but you're not sure if you're really doing it the way it might be, and then you hear another clinician speak, and it's just a very supportive community.
And the interactive component was just incredible. Just having the opportunity to pick their brains, if you will, and ask questions and to get the feedback. It was just a really unique opportunity.
I just wish you guys would do it in San Fran. We got nothing like this. I'm a lifespan groupie.
There you go.
These are resourceful tools for teachers, libraries, clinical practice, and your personal collection. All our conferences are accredited by the American Psychological Association, the California Board of Behavioral Sciences, the National Board of Certified Counselors, the California Society of Clinical Social Workers, and the California Board of Registered Nursing. Lifespan conferences are available on audio CDs and video DVDs. Visit us online at www.lifespanlearn.org for information on upcoming live conferences and available recorded conferences.